The primary sensory cortex is located in which lobe of the brain? A. Frontal. B. Parietal. C. Temporal. D. Occipital. The nervous system is a complex network that coordinates the body's activities and responses to internal and external stimuli. It is divided into two main parts: the central nervous system, CNS, and the peripheral nervous system, PNS. One. Which part of the brain is responsible for coordinating voluntary movements and maintaining balance? A. Cerebrum. B. Cerebellum. C. Medulla oblongata. D. Thalamus. Rationale. The cerebellum is responsible for coordinating voluntary movements and maintaining posture and balance. 2. What is the primary function of the myelin sheath? A. To generate electrical impulses. B. To protect neurons from infection. C. To increase the speed of nerve. D. To support and nourish neurons. Rationale. The myelin sheath insulates axons and speeds up the transmission of electrical impulses along the nerve cells. 3. Which neurotransmitter is primarily involved in the fight-or-flight response? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Norepinephrine. Rationale. Norepinephrine is released by the adrenal medulla and the sympathetic nervous system during the fight-or-flight response. 4. The blood-brain barrier primarily functions to: A. Supply nutrients to the brain. B. Protect the brain from pathogens and toxins. C. Regulate brain temperature. D. Facilitate cerebrospinal fluid circulation. Rationale. The blood-brain barrier prevents harmful substances from entering the brain while allowing necessary nutrients to pass through. 5. Which of the following cranial nerves is responsible for eye movement? A. Optic nerve, 2. B. Trigeminal nerve, V. C. Facial nerve, 7. D. Oculomotor nerve, 3. Rationale. The oculomotor nerve controls most of the eye's movements, including constriction of the pupil and maintaining an open eyelid. 6. Which part of the neuron receives signals from other neurons? A. Axon. B. Cell body. C. Dendrites. D. Myelin sheath. Rationale. Dendrites are the structures on neurons that receive electrical messages from other neurons. 7. The autonomic nervous system is divided into which two main branches? A. Central and peripheral. B. Sympathetic and parasympathetic. C. Sensory and motor. D. Somatic and visceral. Rationale. The autonomic nervous system controls involuntary body functions and is divided into the sympathetic and parasympathetic branches. 8. Which area of the brain is responsible for speech production? A. Wernicke's area. B. Broca's area. C. Hippocampus. D. Amygdala. Rationale. Broca's area, located in the frontal lobe, is essential for speech production and articulation. 9. Which type of glial cell forms the myelin sheath in the central nervous system? A. Schwann cells. B. Astrocytes. C. Oligodendrocytes. D. Microglia. Rationale. Oligodendrocytes form the myelin sheath around neurons in the central nervous system. 10. The primary sensory cortex is located in which lobe of the brain? A. Frontal. B. Parietal. C. Temporal. D. Occipital. Rationale. The primary sensory cortex, responsible for processing sensory information, is located in the parietal lobe. 11. Which of the following is a common symptom of Parkinson's disease? A. Muscle rigidity. B. Increased heart rate. C. Double vision. D. Severe headaches. Rationale. Parkinson's disease is characterized by muscle rigidity, tremors, and bradykinesia, slowness of movement. 12. Multiple sclerosis, MS, primarily affects which part of the nervous system? A. Myelin sheath. B. Synaptic cleft. C. Neurotransmitters. D. Cranial nerves. Rationale. MS involves the immune system attacking the myelin sheath, leading to communication problems between the brain and the rest of the body. 13. Which medication is commonly prescribed to manage seizures in epilepsy? A. Insulin. B. Diazepam. C. Phenytoin. D. Lisinopril. Rationale. Phenytoin is an anticonvulsant medication used to control seizures in epilepsy. 14. Which condition is characterized by sudden, severe, and recurrent headaches often accompanied by nausea and sensitivity to light? A. Stroke. B. Migraine. C. Meningitis. D. Encephalitis. Rationale. Migraines are severe headaches that often include symptoms such as nausea, vomiting, and sensitivity to light and sound. 15. What is the primary treatment goal for a patient experiencing an ischemic stroke? A. Reduce fever. B. Manage pain. C. Restore blood flow to the brain. D. Decrease inflammation. Rationale. The primary goal in treating an ischemic stroke is to restore blood flow to the affected area of the brain as quickly as possible, often using thrombolytic therapy. 16. Guillain-Barré syndrome is characterized by A. Progressive muscle weakness and paralysis. B. Rapid onset of severe headaches. C. Chronic joint pain. D. Recurrent seizures. Rationale. Guillain-Barré syndrome is an autoimmune disorder where the immune system attacks the peripheral nervous system, leading to muscle weakness and paralysis. 17. Which of the following is a typical sign of meningitis? A. Sudden, severe headache. B. Chronic back pain. C. Persistent cough. D. Weight gain. Rationale. Meningitis often presents with a sudden, severe headache, neck stiffness, fever, and sensitivity to light. 18. Which diagnostic test is most commonly used to detect abnormalities in the brain's electrical activity? A. MRI. B. CT scan. C. EEG. D. PET scan. Rationale. An electroencephalogram (EEG) is used to detect electrical activity in the brain, often used in diagnosing epilepsy and other neurological conditions. 19. Bell's palsy primarily affects which cranial nerve? A. Optic nerve, 2. B. Trigeminal nerve, V. C. Facial nerve, 7. D. Vagus nerve, X. Rationale. Bell's palsy is a condition that causes temporary weakness or paralysis of the muscles on one side of the face due to dysfunction of the facial nerve. 20. Which of the following treatments is commonly used to reduce intracranial pressure in patients with traumatic brain injury? A. Fluid restriction. B. Diuretics, e.g., mannitol. C. Antidepressants. D. Beta blockers. Rationale. Diuretics like mannitol are used to reduce intracranial pressure by decreasing fluid volume in the brain.